thank you, Marcelo, for the presentation, and thank you for the organizing committee for inviting me to be here. I want to start by congratulating the committee for carrying out this conference in these unusual circumstances. And I have to say, I'm a member of the technical program committee, but I never expected to be speaking here on this other very different topic, which is the role we've been having as providers of scientific advice to the Uruguayan government in response to the COVID-19 pandemic. So I will jump right into the topic and tell you all about how this thing started in Uruguay with COVID. And the context is that the government had only taken office on March 1st, and before 2 weeks we had the first COVID cases here. And in fact, there was a wedding event and a lot of initial spread. So in about 2 weeks, we were with 300 active cases. So it was a pretty scary beginning. And clearly, the initial efforts were somewhat frantic to be able to control these initial cases in a situation where the testing capability was initially very limited, and the experience of the government too. So what the first measures were an health emergency declaration, some initial measures of closing the borders with few exceptions, closing all schools, closing public events, and mainly urging people to stay at home. It was not a mandatory lockdown, it was a recommended lockdown or recommended stay-at-home orders. Still, there was a very, very strong response, and that's a picture of one of my main avenues in those days, and pretty much nobody was out there. So the initial response was stay at home. And there's also an initial response from the many people in many areas, in particular in science and technology. And I will give a few highlights here. One of the main hallmarks was that the scientists in the bio area at Instituto Pasteur in Montevideo and the Universidad de la República developed homemade testing, viral testing, PCR testing capabilities, which by the end of March they had validated, and that was very crucial because availability worldwide of these tests was scarce. And together with the private sector, these were turned into kits within a month or so. So that was a very important first initial response from the scientific community. Also from the IT industry and the IT agencies of government, there was a quick deployment of an app for reporting COVID-19. And a little bit later, this app was endowed with this Bluetooth contact tracing based on the Google and Apple solution. So a lot of people from different areas jumped in to try to help. And many others, in particular on my side, on the data modeling side, also mobilized to try and develop models to track what was going on, make initial projections. There were groups on the Universidad de la República. I was involved in the Academy of Sciences, and many others were there. So this was the initial sort of spontaneous response of many sectors to try and do something to help the epidemic. Then in mid-April, the president decided to summon an honorary scientific advisory group, which was directed by Professor Rafael Radi, who's a noted biochemist. And he created this organization where there was two sectors, the health sector coordinated by Dr. Henry Cohen, who's a clinician. And then I was called to coordinate efforts in modeling and data for the epidemic. And this is the point where you might be asking yourselves this question, right? Why will you call an electrical engineer for an epidemic? And I indeed ask myself the same question. Part of it is you're summoned and you feel the call of duty. This was a very unusual situation. I would say in my defense that most of my career has been in models of applied mathematics, dynamics, control networks that are not too different from epidemic models. But of course, I hadn't specifically worked on epidemics and had a lot to learn in that regard. And also a lot of help to recruit help from other people who are more experts in the field. So this was sort of the mathematics side. And a lot of people around the time and in some interviews, they call me a mathematician, but that's partly true because I have a degree in mathematics and I have theorems in my papers. But I think the engineering side was equally important, particularly notions from feedback control appear a lot in this problem. This is an open loop unstable system. There's uncertainty, time delay, actuator saturation. There's many things that we know we at least intuitively know how to manage in control engineering. And more generally speaking, the engineering training gives you an idea of when you're looking at math models for anything, to combine the sort of the blind math models with some common sense intuitions. And I think that was a helpful tool because in many situations we had very sort of not very clear predictions. I will tell you a little bit about that later. In any event, this was I'm not sure if I was the man for that job, but it was a challenging job. And furthermore, it was done with a lot of media exposure. So that's pretty much the background of what got me into this problem. And now let me tell you about a little bit about the modeling efforts for the epidemic, and then I'll return to follow what happened here in Uruguay in the next following months. So just to give you a brief tutorial on the COVID-19 or an epidemic from the point of view of mathematical models, you can think of the infected population as a dynamical system because it produces its own growth rate through contagion. And it's an unstable system if you don't control it. Right? Everybody's heard about the exponential growth of infections over time. That would happen if you just leave it alone. And there's this parameter called the reproduction number that we've all learned to hear about, which says that what's the average number of secondary infections for each infection. And if you take COVID-19 in the sort of natural state without taking any control measures, it will be 2.5 to 3 in most estimates. That means that every week or so you get a 2.5 to 3 more cases of COVID, and this is like the exponential. Okay, so what can you do? Well, you can start taking some control actions. I'll tell you about those in a minute that will reduce this growth rate, and then the curve starts slowing down. Eventually, if you can reach this reproduction number less than 1, then the number of infections will start to go down and it will be contained. This will happen spontaneously if you just let the infection go after most of the population has been infected, and that's what's called herd immunity. But usually you don't want to go there. That's a very costly way to control an epidemic. So what can you do to control it in a better way? Well, there's basically 2 types of control actions. One is actions you take on the overall population, sick and healthy. Most of the people are healthy initially, and you just take basically social distancing measures. And stay at home is one of the most extreme, but you could do intermediate things. It requires a very unified message from the authorities. Everybody has to follow these directives. And of course, it has a high cost in the economy to keep everybody sort of stay at home. And so that the issue with these things is long-term sustainability. The other packet of measures is what you call the testing, tracing, and isolating of infections, of infected cases. And the Tetris is a way to summarize these initials: testing, tracing, and isolating. And you can basically what you go is you find an infected case, you confirm it through the viral testing, then you go trace all the contacts of that person and you test them as well until hopefully you cover the entire set of contacts, and then you've isolated the outbreak. In comparison, the costs are lower, but you require some capabilities. The first one is this PCR testing capability. And also you need a dedicated personnel who can do this tracing in a very active manner. And finally, for isolation, you need to be able to do much of the medicine at home. So these are 2 different strategies. They're complementary. But the second one requires you to be prepared, and the first one is potentially very costly. Okay, so just to give you one brief look at one mathematical model, one of the simplest and oldest ones for epidemics, to put these measures into some context. You can think of this classical SIR epidemic model. S is the susceptible population, people who can get the infection. I is the infected population, people who currently have the infection going. And R is the removed population, the people who already had the disease one way or another. And these differential equations in these three variables are basically understood as follows. You have this parameter beta, which is the contagious contact rate. What rate does an infected person have a dangerous contact with another person? And that will create new infections at a rate proportional to beta, to the number of infections, and to this fraction, which is the fraction of people in the population who are still susceptible. With that rate, you go from susceptible to infected. And then there's another rate gamma that takes you from infected to removed, which is the rate at which the disease runs its course to you recover, or unfortunately you may die. So these are the simple parameters of a very simple model. And I must say that there's many variants and extensions of this model to more compartments than 3. You can even do regional populations. You can do graph-based models. There's a lot of variety of models, but I think the simplest one gets the main ideas across. So what happens initially? Let's say you have a new disease like this one. Nobody's immune. And so you look at the middle equation, you approximate S over N by 1, and you see that you get a linear differential equation that if beta is larger than gamma, it will have an exponential growth solution. And that's precisely what I mentioned before. This R0 parameter in this model can be interpreted to be beta over gamma. If that parameter is greater than 1, then the epidemic will grow exponentially. And the measures you can take to avoid this can be basically understood in this simple model in this way. By taking physical distancing of the population, you're actually reducing beta. You're reducing the contact rate between people, everybody, and in particular the infected population. So the social distancing or physical distancing is mainly acting on beta and reducing beta. On the other hand, if you do this testing, tracing, and isolation, what you do is remove people not from the infected states, but from the contagious state. And it's like you're actively increasing the rate gamma of removal from the I state. And finally, if the epidemic grows far enough, and so the susceptible population goes down, or if you manage to get a vaccine that makes the susceptible population go down, then you reach this immunity status, and then this coefficient on the left will go down on its own. And then you control the epidemic. Okay, so I thought it was worth doing one slide on models, but this is not going to be a talk about models, just to give you an idea of what kinds of things people look at. And there's an initial debate in the community between two strategies, what was called mitigation versus suppression. Mitigation is you control enough to stop the exponential growth, but you don't attempt to remove the disease. You just attempt to stabilize it within the capacity of the healthcare system. And you wait hopefully long enough so that most people have had the disease, and that's this herd immunity status. The susceptible population will automatically go down. Or the alternative is, you go very aggressively and you try to suppress the epidemic. You try to take the cases to 0, essentially. And you do that through strong measures and this Tetris strategy. And then after you're close to 0, then you start releasing the measures, and you do this dance around 0. So it was called the hammer and the dance by this very popular paper a few months back by this business guy called Tomás Puello. He argued very effectively for this. And so he argued that you should do the second strategy. Okay, it's not an obvious discussion, but one thing we found is that if you wait too long, if you do mitigation and you wait long enough, then the effort you have to do to mitigate is still very high. So it's as hard as the hammer in some sense, only you do it too late and perhaps it is less effective. So it's not this alternative between the economy and the epidemic was really a little bit of not a realistic alternative, because it was very costly too to keep mitigation and not just the suppression strategy. And it takes a long time to reach this herd immunity status. So this waiting for herd immunity might be excessively long. So in retrospect, it seems like the hammer and dance has been the strategy was most successful in this event. And so, having said all this, let me go back to the Uruguayan case and tell you how we did. And so this was the situation after 1 month in Uruguay. And these are the number of new cases. The incidence is the number of new cases we get every day. And you see that the initial break, which I mentioned, which took the cumulative number of cases up to 300 very, very fast, that stopped and with these initial measures, and we got a sort of stable situation. The blue curve here is the number of infected cases. The red curve is the number of recurrent cases, and the green is the number of deaths. Sorry, I think the number of deaths is the bottom of the purple. In any event, the number of infected cases, which is what gives you an idea of the state of the epidemic, was stabilized within a month. And this reproduction number, which you can estimate from the data, and which my colleague Ernesto Mordecki has been doing on a daily basis, tells you that within a month in Uruguay we had some degree of stability of the epidemic. Okay, so here's what the government says: can we open up? And that's where we got called in for this advisory committee, and to support the transition to this new normality status. It was very early, you might think, looking from today, right? It was only a month had gone by. We had an initial success, but to think about reopening was a little bit worrisome. So that's why the president invited us to give advice, and in turn we invited a lot of many other people to help us in this. We organized them in several teams, and many others in the scientific and technological community were indirectly connected to this group. So it's been an effort trying to get the best possible advice under the circumstances, and provide it to the government, who will then take, of course, the decisions by its own responsibility. Okay, so what were our initial recommendations? And the first one was progressiveness. We need to go slowly, right? This is and here's where some of these control theory metaphors are useful. This is a system that has both uncertainty and delay. You only see the effects of your measures in weeks. So you need to move on your actuator in a slow way. And I guess I've always used this metaphor of controlling the temperature of an unknown shower. So you're in a shower and you don't know where to put the position of the tap. If you act too aggressively with a too high a gain, then what you do is you alternately burn and freeze, because you don't wait for the delay of the system to settle. And so that kind of helps communicate to the government. This is a system you have to move slowly, the control actions, and release slowly. And if necessary, take steps back. So regulation means you may have to take a step back. You need to monitor. This was the third piece of advice. You need to measure before taking a next step. So take one step, measure, wait a couple of weeks, measure how things are, and then move. And for that measurement, it's important that you have testing capacity, because you need to do this viral testing extensively. And it was good that by then we had already, in Uruguay, had already developed testing kits. And finally, the recommendation is go with the best available evidence from the biological journals. In particular, what openings you do have to do with, for example, it was found that outdoor transmission was not too significant, so perhaps you can let people out of their houses under enough distance. It was also found that small children were not too infective in this disease, so perhaps you should reconsider the closing of schools. And this is the kind of advice that the group could give to the government. Okay, so let's look at the second month, and things still looked very good. There were some sectors reopened, all of them under some certain physical distancing rules: rural schools, the construction sector, some of the retail, some of the public offices. And still, after 2 months, we were in declining state of infections. And so the decision was made to reopen the urban schools in 3 waves during the month of June. And if you look at things 3 months or 1 month later, we're doing still very well. We're even close to what you would call the suppression state. There's almost, in mid-June, we had a few days with 0 or 1 cases. And all of this with increased activity. So it looked like we were perhaps being able to suppress the virus. The active cases were close to 0 as well. which is what places like New Zealand did. And so perhaps we could aim for the New Zealand solution, which is to completely eradicate and then have a normal life with closed borders. But it was not so easy because we're not as isolated as New Zealand, and our neighbors, Brazil and Argentina, first Brazil, more recently Argentina, have had very large epidemics. So, and our borders are not open, but they're not completely blocked as New Zealand. So we can expect to have some degree of coupling with the rest of the region. And indeed, what we've had since is not zero, but a complete, basically this dance around zero, which I was mentioning before. So we have recurrent outbreaks that fortunately have been controlled. A couple of them have come from the Brazilian border, Rivera and 33. Some of them occurred here in Montevideo, which is a very situation because Montevideo is a bigger city. Particularly was this event in the health sector, which was very worrying in sort of late July, mid-July. And so look at it from today and you see this control, but of course, things could go wrong. The equilibrium is fragile. This is a comparison between Uruguay and Costa Rica, which is a similar sized country. Up until June, we were doing essentially the same. Then they lost control of the epidemic and you got the exponential growth. So it's not a state that you can guarantee will go on forever. So in particular for a scientific advisor, I just want to relate the moment where you're standing here in the late July, and this is the curve you're looking at, and and you ask, okay, is this another temporary outbreak or is this the start of exponential growth? And some people are telling us we have the same number of daily cases we had at the beginning of the epidemic. Then you send people home. Why not do it now? And that's the question you get asked, and you have to provide some advice. And it's not an obvious question. If you go to the mathematical models, they're not very conclusive in this situation. Why? Because this is a very noisy system around zero. The epidemics which are bouncing around zero have a lot of variance. And so it's very hard to say what will happen. And there were some colleagues telling us, you should send people home because my projection is going up. We still took the position that it was too early to do that, and we were still in relative control, and we went into a press conference and said this. Unfortunately, the reason we said this is basically that the key thing which we learned is that there's a key threshold in this epidemic. As long as you're within your capacity to test, trace, and isolate, which means you find all contacts and isolate them for each case, as long as you can do that for the number of cases you have, then you can avoid exponential growth. Particularly since these numbers were obtained with 10 times more testing than at the beginning of the epidemic. So these were probably much more reliable numbers at the beginning. And also human resources that were doing the traces had since been reinforced. So we thought, okay, as long as you don't saturate the capacity of the people doing this tracking, you can hope to avoid this exponential growth. And that's indeed what happened. And since then, we've had many ups and downs like this, but we haven't had exponential growth yet in the country. And we still haven't overwhelmed or exceeded the tetrascript capacity. So where are we now? We're quite close to new normal if you look at the activities that have been authorized. Of course, they're not authorized in the normal way. There's some physical distancing protocols included, but most activities are occurring. Mainly, we're trying to avoid large gatherings. Some of them happen anyway. There's some demonstrations have occurred which are dangerous, and we haven't done it. We have very restricted borders still, so we're not letting tourists in, and with visitors under special circumstances are tested, have to have viral testing before they come in. The capacity of tracing is being pressed. We are within capacity, but we're not. We're not completely quiet. And there's always a danger that if this gets exceeded, we could go to the situation which is called community transmission, where the virus is contagious, but you don't know where. And in that case, the most likely scenarios would be an exponential growth, and you would have to basically send people back take steps back in confinement. So there's a tension here, and I hope I've explained it, between overreacting and sending people home at every single stochastic random burst, and so that's not good, but it's also not good to lose control. And in some regards, the metaphor of the shower that I mentioned earlier is not as effective as perhaps a better metaphor is the fire. If you have you're in a forest and you have little small places of fire, you go there and you basically cut the trees around it and turn it off. But if the fire has spread, then of course you cannot do that anymore. So you're beyond your capacity. Okay, so looking ahead and trying to wrap this talk up, how long can we keep this up? Of course, there's no clear end in sight yet. We're particular because the strategy we've embarked in, the suppression strategy, it gives you no natural immunity. So to end this situation, you would need either have vaccines or have better treatments, which are not there yet. They might be coming, hopefully. And so we need to keep this for some time still. And at the end of the year, we're going to have a new challenge, which is to what degree we can allow or not some degree of tourism into the country, which is the main season, and it's a very important economic activity. And it's not clear. And it depends a lot in the state of our neighbors, which hopefully would be improving by then, because in that degree, we're coupled with the rest of Latin America, where we can keep isolated for a while, but our destinies are together. So having summarized this, I'll leave it here and open up for questions.
Thank you, Fernando. I have a question. My question is if this body of knowledge can be used for other situations, for example, in other infectious diseases.
Okay, I think a lot of it is probably, and the answer is there's probably a lot of it that eventually would be useful. We will, one of the objectives of, in particular, our advisory group is to document a lot of the information that we have found. There's a huge literature have been developed worldwide, of course. Important part of the job here has been to keep track of what has been learned and try and summarize it in a useful way. So there's a lot of information that, yes, will be useful for epidemics. Some of the things are specific to this one, some of the specific ways of contagion and so forth. But yes, I think generally speaking, there's very important things to be learned. Yes.
Okay, thank you, Fernando. If some other assistant attendee would ask some question, I will send to Fernando because we are running out of time. And thank you, Fernando, very much for your very interesting presentation. And well, next.
Okay. You're welcome. So
bye-bye.
Thanks. Bye.